As the lead collaborators have made clear today, our actions in this effort can establish either a virtuous cycle or a vicious cycle in our overall ambition to protect frontline and community health workers. So I see the virtuous cycle would be enabled by protecting frontline and community health workers with PPE. We know that this would enable continuity of essential health services and allow the workforce to safely prevent, detect, and respond to the coronavirus. So we've seen that community health workers can maintain treatments for malaria, assessments for malnutrition, and support for pregnant women. They can provide community education on COVID. They can increase practices like universal masking, and they can refer suspected cases for COVID. And we believe that they can also contribute to testing, contact tracing, and eventually support the distribution and delivery of a vaccine in the future. But as people have made clear, none of that's possible without PPE. So with PPE, there's a virtuous cycle. Well-supported community health workers ensure safer and healthier communities. But conversely, inaction right now will lead to a vicious cycle. If community health workers aren't equipped with PPE, they'll be faced with the difficult choice of putting themselves and their families at risk, and many will be sent home. Governments are not going to reap the potential value, and they may actually start to decrease their investment in strong community health worker networks and systems. And that would leave vulnerable communities at the last mile behind, not just in relation to COVID, but in our overall efforts to increase UHC. So I see us standing at a crossroads right now. PPE will determine which scenario is realized, a vicious or virtuous cycle. And I know that many of you already agree that CHWs need to be protected, that obviously we have to choose the virtuous cycle. And so if we believe that protecting them is important and we need to do that at scale, that's going to require a number of actions. It's not to this fund alone, but it will need to include this fund and pooled procurement as an option. So let me put that in perspective from Last Mile Health. So in March, we launched into our own efforts to directly procure PPE and needed to purchase immediately 2.5 million units of PPE for our work in Liberia and Malawi. We pursued direct procurement because there was no other option available to us at the time. The Ministry of Health procurement was not prioritizing community health workers. The WHO and WFP system was not available. The Africa Medical Supplies Platform didn't yet exist. This COVID Action Fund for Africa didn't exist yet. So it was an odyssey for us to vet suppliers, to find even a single viable shipping option. The shipping costs ended up being above $70,000, and the process took more than 5 months. So if I compare what we're talking about today to that direct procurement effort, we expect this COVID Action Fund for Africa to reduce the uncertainty, provide some better control for quality, move products more quickly, and drive down the unit costs by negotiating and pooling these larger quantities, as Tom talked about. So we have an option in front of us. It's one of a number of efforts that we need to get behind together, and I can see the real value as we lead implementation in a couple of the countries where this effort is underway.
Thank you very much, James. So we have Ramatu. We're not going to do this without a front